questions that they would want to ask. So if you're listening and you have any questions regarding our conversation on breast cancer, you might want to send us a WhatsApp message on 055 or a bit later when we activate the phone lines, you can call on 0302
Right, Kwame, good afternoon once again, and good afternoon to all our lovely listeners who have tuned in. Last week I couldn't be here. I think that's why I'm super excited this week.
Yeah. We had it on phone.
Was it?
Not feeling him. I know.
Yeah, so it's good being in the studio and see you and all the guys in the production team. Right, so last week we started a conversation about a very favorite part of the human anatomy.
Oh, is it? Is it?
When we asked the question last week,
whose favorite?
Everybody's favorite.
Everybody's favorite, really?
Yeah. Oh, the
I
babies
didn't know.
love it.
The babies love it. Okay.
Yes. I hear the male babies love it more.
The male babies love it more.
I don't know why, but it's like when they open their we open the lines, they should call it.
We should ask why.
You ask whether that is even true.
So when you were a baby, you love it. You loved it.
My mother is the one who can tell.
Okay. So, but a smile on your face tells that even now.
I'm not talking presently. I can't pass them.
Oh no, you didn't grow out of it.
Maybe I only took a break.
I know, right?
Right. So October every year is Breast Cancer Awareness Month. We call it the Pink Month, and I'm sure by now everybody knows that we're talking about breast cancer when we talk about Pink October. And we can't say it enough because it's a very deadly medical condition, and unfortunately it's not only the woman that gets affected. Well, indeed, 1% of all cases, as I mentioned in the presentation last week, 1% of all cases occurs in men. So yes, men do also have breast tissue, and therefore men can also have breast cancer. And that's the thing that I tell some people, and then people look at me and say, "Hey, doctor, and you're not just in back when you fear your thing." It's not a matter of fear your day, but it does happen that once you have breast tissue, although ours or the one in men not well developed, you can still have or suffer from any disease that affects it. So I think we went through the risk factors of developing breast cancer, and then we also looked at some of the signs and symptoms. Because we were so overwhelmed with, I think phone call, you were telling me that there were a lot of messages that came in. Today we're just going to do a lot of Q&A. So today I just want to focus on a very important aspect briefly, which is a breast self-examination. Breast self-examination? Yes. Because one of the key pillars of fighting this breast cancer thing is early detection. If you look at the various stages, we stage breast cancer from stage 0 to stage 4. And if you present early, at an early stage of the disease, your survival chances are very, very high. So those who present, the 5-year survival for those who present to stage 0, stage 1, 100%. Meaning at 5 years, most of them are around. But then if you hit stage 3, then you drop to about 77%, and then stage 4, those who present in stage 4, about 22% at 5 years. So unfortunately in Ghana, most of the people who present in the latter stages of the disease. So it means our health-seeking habits, the early detection methods and all of that, we do not pay enough attention. And that is why the breast self-examination has become absolutely important. So that's what I'm going to focus on today. So how is it done? So number one, you should find, or let me divide it into two. So you've got women of the reproductive age, and then you've got the women after the menopause, or the postmenopausal woman. So before menopause, we say the woman is in the reproductive age group, meaning you are having your menses regularly. You've got to pick 5 to 7 days after your menses to do your breast self-examination. So 5 to 7 days after your menstrual flow, that's the time that you choose to do your breast self-examination. You've got to have a mirror. So the first thing is you stand in front of a mirror and you expose your breast, or you stand in front of the mirror topless. And then with your hands on your waist, or held together over your head. You first of all, you look. What are you looking for? You're looking at the breast and you're looking for asymmetry. So no two breasts are the same exactly, but by and large, it will take somebody with concerned eyes to see the asymmetry in the breast. But if obviously there are differences, just by looking in the mirror, then that is the first thing to pick up on. So most women would or should know how both breasts look like. You're also looking at the shape of the breast. So size first, then you're looking at the shape of the breast. You're also looking at the skin of the breast to look for things like dimpling. So Kwame, you know the orange skin peel appearance. I think last week I put up some pictures.
Yeah.
So it looks like an orange peel. If you begin to see that kind of dimpling
with the pores, like very large pores or so.
Exactly. So if you begin to see that or dimpling or puckering of the skin, or you even notice a rash on your breast. There have been a few cases where that's how it all starts, a rash. They'll be, this was a rash, and then I scratched, then it became an ulcer, and they think that it's a scratching that led to it, but indeed, that is how it is presented. So that's the things that I want you to look for when you stand in front of the mirror and you look. So you're looking for change in the size and the shape of the breast. You're looking at the skin for dimpling and puckering of the skin. All right. And if you do this, then you move on to step 2, which is feel. So you look first and then you feel. For this, you've got to lie down supine, that is on your back.
Okay.
Very comfortable bed. And place your free hand behind your head. So let's say you're going to use your right hand for the examination. So you lie on the back and then you put your free hand, which is your left hand, under your head or behind your head. Then you're going to feel your breast for a lump or a hard knot or lumps in your breast. Yes. All 4 quadrants must be examined. So using the nipple as the central point, then we sort of like an imaginary line drawn vertically through the nipple, and then another horizontally through the nipple. Then you would have four quadrants of the breast, and then you go in a very systematic manner, preferably an anti-clockwise manner, and then you're looking to feel for lumps within your breast. If you feel a lump in your breast, you can pick up on things like tenderness, whether or not it is painful when you touch on it. You must examine the armpit as well. And Kwame, this is why it is important. I know some people are ticklish, but they should try and do that. The tail of the breast ends in the armpit. Yeah, so recently I delivered a woman, and then the next day I went over and she called me and said, "Oh doctor, I have a swelling in my armpit." I was a bit concerned. And I took a look at it, and there was a big swelling in her armpit, but it was contiguous with the breast tissue. And I explained to her that that's breast tissue. And she was like, "Hey, I don't for so head but the tail of the breast extends or ends in the armpit. So every breast examination ends with an examination of the armpit.
Okay.
Because the tail of the breast is, and again, you are looking for a lump in there. Once you've done all the 4 quadrants, then last you squeeze. So you look, you feel, and you squeeze. So what are you squeezing? You're squeezing the nipple, and you are looking for a nipple discharge. So you try and grab the nipple between your index finger and then your thumb, and you squeeze on it gently. If you are not a nursing mother, we don't expect any discharge from your nipple. Even if you are a nursing mother, then all we expect is to have a milky discharge, milk coming out from the nipple. A bloody discharge is very, very suggestive of cancer of the breast. So Kwame, this is in simple terms the breast self-examination technique that every woman should be able to do. If you're a woman after the menopause or in the menopause, then you can pick any day of the month and conduct this examination. But if you are in a reproductive age group, meaning you are having your regular menstrual cycles, then 5 to 7 days after your menses should be the fixed time with which you do this examination. So, Kwame, I think now is a good time to open the phone lines, and then let's take some calls whilst we try and get everybody on.
I know
board.
folks have questions. If you do have any questions in regards to our conversation about breast cancer and breast self-examination, you can call now, 0302 216 541. If you're on WhatsApp, you can just shoot us a message on 0511. Oh, shoot, no, I missed the numbers again. 055 1111997. Yeah, 055 1111997. Okay, so 0302 216 541 or WhatsApp 055 1111997. Okay. Lots of very interesting commentary about breast. Lexis, this is from Tom Brown. So Lexis, breast dear, it is life for God first, food next, breast follows. If you never enjoyed breast, then you need healing.
Absolutely, that's why we have to pay more attention to it.
Yeah,
it concerns everybody, So yeah.
Lukeman is here. Hello, Lukeman.
Hello, Mr. Lexis.
Yes, sir. How are you?
Yeah, thank you very much for giving me opportunity.
Go ahead.
Yeah, please, I would like to find out from the doctor. He talked about menstrual cycle. So I would like to know, what about the women who are on this thing, on drugs? Something the family planning, family planning. You know, they don't get the usual menstrual cycle like when they are not on drugs. Yeah. So I don't know what happens to those women.
So we'll treat them just like we'll treat the postmenopausal woman. If you're not having your menses, then you can pick one particular day in the month for which you do the breast self-examination. The whole idea is that different times of the month, your breast may feel different. And sometimes you may have some exaggerated lumpiness. All we're looking for is a lump. And not all lumps represent breast cancer. There's so many benign or non-cancerous lumps of the breast. So based on the differences in terms of how the breast feels at different times of the month, then if you pick a particular time, then it is easier to pick up any changes.
Okay. Yeah. Abena, is Abena on the line? Hello, Abena. Hello.
Hello.
Is this Abena?
Yes. Good afternoon.
Good afternoon, Abena. Hi, go ahead. Let's hear you.
Can I contribute to the program, please?
What did you say?
Hello.
Yes, Abena, we can hear you.
I want to find out. I'm in my menopause, and I do the breast self-examination. I've really been to the hospital to do the breast examination. There seems to be no problem, but sometimes I get serious pains in my breast. I don't know what else can give me those pains.
All right. So the line is a bit difficult, but I think she said she's in her menopause. And she has pain in the breast?
Yes.
Also, okay, all right. So one of the things about breast cancer, and I think that's where we have some of the difficulties because of our health-seeking habits in Ghana, is that we tend to ride on pain. If it's painful, yes, we go and see the doctor. But in the initial stages of breast cancer, usually there is no pain. There is a lump, but it is totally painless in the initial stages. So if you are experiencing pain in your breast, there may be several other conditions that may not necessarily be breast cancer. It will be good for her to pay a visit to a health service provider. Could be an experienced nurse, could be a doctor, to look at the different things that can cause and that. There's something called fibrocystic change or disease of the breast that can sometimes cause a bit of pain in the breast as well. So
Raymond is here. Hello, Raymond.
Hello.
Welcome, Raymond.
Thank you.
Let's hear you.
Listen, I heard something about the tail of the breast.
Yes.
And my friend wants to find out, and that's what I got.
What do you want to find out exactly?
What it is?
Oh, okay. Oh, right. Raymond, I was just describing the anatomy of the breast and saying that the breast tissue is not just what you see on the chest, but then it extends into the armpits as well. So every examination of the breast should end with examination of the armpit. And that extension of the breast tissue into the armpit is what we refer to as the tail of the breast.
Okay. And Sarah wants to find out. Sarah says, hey, Lexis, this examination there, be romanzo. Kindly ask the doctor if your husband or your fiance can do it for you. Sarah in Winneba.
Absolutely. I mean.
Oh, really?
Oh, yeah.
That's one can in them. You should have said that one earlier.
Hey, Charlie, there are people who use that as,
No,
we're just
examining and helping, Doc, you should have said that earlier. I mean,
I'm sure the mind will be there. You see, the hand must be able to feel what the brain is thinking about.
Who said? Let the hand feel what you feel. Let the brain also think what you think. Right. Okay. Let me see. Quick one here. Is it normal to feel lots of lumps in both breasts? Kind of like both breasts are full of lumps. Could that be just how the breasts are? And if it's normal, what are those lumps? Are they normal breast tissues from 9 Spintex?
Right. So now you've described a condition that most of the time it turns out to be something we call fibrocystic change of the breast. We used to call it fibrocystic disease, where the breast feel very lumpy. I said, I know you don't know how to make porridge, but when you attempt the porridge,
when I start cooking, you see me. You should go on my YouTube channel. When I start my cooking show, you go feel me.
I saw you with your
No, now I am.
Right, so there's the lumpiness that you can experience, especially when it is both breasts. We used to think that it was a disease, so they used to call it fibrocystic disease, but now it's so commonplace. We think that these are natural changes that occur in the breast with time, so now they call it fibrocystic change. But I wouldn't just sit on radio and then just conclude that the lumpiness is as a result of that. But that is a benign breast condition, and she should get her breast examined by a healthcare professional, probably a doctor, before we can draw that conclusion.
Ella wants to find out, Doc, when you squeeze the nipple and a thick white substance comes out when you are not a nursing mother, what does it mean?
Right. So if you're not a nursing mother and you have a whitish nipple discharge, then it could be that you have a rare type of brain tumor. So there is
brain tumor.
Yes, there is a type of brain tumor called a prolactinoma. A prolactin secreting. So prolactin is a hormone that regulates or promotes the production of milk. So if that part of your brain is involved in a tumor, meaning it is overproducing prolactin, it is possible that the breast then begins to produce some milk, although you are not a nursing mother. So that is where we'd look at. Your doctor will probably ask for you to get an MRI or a CT scan of the brain to look at that particular part of the brain we call the pituitary, just to make sure that you don't have a prolactinoma. You can do a simple blood hormonal test as well. You draw a blood sample and then also measure the levels of that particular hormone. So now if you are having this, then you definitely need to get in touch with a doctor.
Good evening. Please, the folds under my breast are very dark, darker than my complexion.
Yep.
This has spread to the middle, that's between the breasts. Are these signs of breast cancer? Can I apply an ointment, Samosid? Because I apply an ointment, Samosid, it goes and comes back when I stop using the ointment. What can it be? There are no changes in my breast, though.
Right, okay. So she's referring to the folds under the breast, and she talks about a darker complexion compared to the rest of your body. So that's a fold. In that area, the skin meets because there is a fold. Probably itches. If there's a question I would ask her. Probably she itches under her breast, and a lot of women may have that particular condition. We call it we call it an intertrigo, where there are folds in the skin. So some have it in their groin, some would have it in the curves of their armpits, but most commonly it's under the breast because there's the fold. And those who have very large breasts, and then you are in an environment where you sweat a lot, so it's very humid in our environment, it's very hot, and it is possible for you to get that kind of inflammation, and sometimes you get a bit of an infection. So I'm sure the ointment he applies has some bactericidal creams in content, and then also that. So it's an on and off thing. It goes and comes. And it can be treated, but yes, it is the sweating, the humid nature, and then the fact that it's a fold. So it's very difficult.
Yvonne is here. Hello, Yvonne.
It has nothing to do with.
Hello, Lexis.
Yeah. Welcome, Yvonne. How are you?
Hello.
How are you,
Hi,
Yvonne?
Hi, Yvonne.
I'm fine. I'm fine, Lexis. Thank you.
Very well, too. Thank you. Go ahead.
Yeah, I wanted to ask, after you wean your baby, after you stop breastfeeding, after how long are you not supposed to see milk when you press your nipple?
It's variable. It's variable. It doesn't stop instantaneously. But yes, I think if you've stopped or you've weaned your baby and then it's 2 months, 3 months, and you still express and you still getting a lot of nipple discharge, then it will be something that we would want to look into it. But usually after that period of time, without the stimulation, it should stop. But it may be that the baby is not suckling, but somebody else too is. Why are you so excited?
I'm not excited. It's just funny. You know how you say stuff like that and then you're looking in a room for the guilty one. And you turn to the man of the house and you're like, yo, what's up, brother?
Then he's reading his newspaper.
he's reading his newspaper. He's on Peter in Taifa says, please ask doctor when a man should be worried, and for that matter, go for a checkup.
Right. So, Peter, the last about 18 months ago, I diagnosed a man, 77 years at the time, with breast cancer, and it was an incidental finding of a lump. He himself did not complain about it. So, finding breast cancer in a man, it's not straightforward, but the lump is the one that gave it away. So, if you have a lump in the region of the breast, the nipple, and then the areola, the dark skin around the nipple. So if you're a man and you have a lump, you can feel a lump in that region, then you should go and check it out. So for men, there isn't a lot. You can't do a breast, a sort of like examination the way we've just described for the women.
Good afternoon. I want to know what causes lumps in the breast. 3 family members have removed lumps in their breast recently between ages 29 and 36, both male and female.
All right. So, well, the commonest lumps that we take out, something we call a fibroadenoma. So again, that's a benign breast lesion. So there's a lump. Typically, the lump is painless. It is very mobile. It is not attached to structures. You can actually hold it. And when the lumps are removed, your doctor must, and this is must in capital letters, must send the sample that has been taken out, the tissue that's been taken out, must send it to the histopathology lab, Professor Akosa and Co., for them to look at it. They are the ones who are going to make a definitive diagnosis, having examined it under the microscope and looked at all the parameters and say, okay, you know what, this is not breast cancer, this is a fibroadenoma, this is what? Fat tissue, sometimes even fat tissue. When you have trauma to the breast, somebody hits you, or it's a road traffic accident, there's something we call traumatic fat necrosis, where the fat undergoes a process of saponification, where how they use oil to make soap, so it becomes hard, so that key soap that we get from like hardening of the fat, saponification. So if you have a very traumatic experience, to the breast, you can get a hard lump forming in there. So there are quite a number of different things that can cause a lump to appear in the breast. Most of them are benign conditions, but one of them can be cancer of the breast, and that's what we're scared of. Okay.
Well, it's been good education on breast cancer. Thank you so much, Dr. Yaw Osafo, CEO of Medicus Hospital.
Thank you.
I'm sure a lot of people have more questions, but we can't have all day. So please put across your number and how they can contact you.
Right. So for those who want to come over or contact us, the number is 0501 477 340. 0501 477 340.
All right, and you can go by Medicas Hospital as well in Mampong Equiapim or Medina Firestone. Let me just chip in this last question, please. I want to know if the talc powder around the breast causes, using talc powder around the breast causes breast cancer.
No, we're not aware of that.
Okay.
No. Yeah.
Thank you so much. Dr. Osafo is CEO of Medicas Hospital. Let's work together to stop mobile money fraud as well. If you receive an SMS alerting you that your account is blocked after receiving a call alerting you of a wrong Momo transfer, do not entertain them. Unblocking of mobile money account will be done only by the mobile money fraud team upon investigation. So report all issues concerning Momo fraud via email to fraud team or SMS 1515, or you can call 100 to report, okay? So haven't you missed how things used to be? I mean, going to concerts, to watch your favorite artists do their thing live, being able to give that random supporter a high five when your favorite team scores that 90th minute equalizer. It will be nice, being able to hug our kids the moment we get home and not after a 30-minute shower. But these restrictions don't have to be with us forever. It is up to us to work towards getting it back. Do the right things, wear a mask, observe physical distancing and other COVID-19 safety protocols so we can all help stop the spread. Then things will go back to how we want them to be. It's up to us. For more information, you can visit covidhqafrica.com. This message is brought to you by Joy FM in partnership with the MasterCard Foundation. Time for the latest updates in news.